Hello, my name is Augustine Kehinde. I'm a student of Brandman University DMP program. Today I'm going to be talking about my stakeholder educational video plan. The purpose of this video is to implement the evidence-based practice in healthcare setting, also the ability to lead change. To identify my stakeholders for my clinical scholarly project about hypertension in elderly African American with low socioeconomic status. The stakeholders for this project are nurse practitioners, medical doctors, medical assistants, clinical managers. The theory and conceptual framework for this project that I'm going to be using is chronic care model. The goal of this project is to design and implement a quality improvement project to address some of the providers' system and patient issues that contribute to hypertension detection and management. The best theory, like I said earlier, is called chronic care model. This care model is an appropriate model to choose for this particular design. According to Wagner et al., 2001, it's a theoretical model that was designed to outline a process for improving the management of chronic care diseases within an healthcare system, such as hypertension. Hypertension is a disease that causes patient blood pressure to elevate above 140/90. And if it's not properly cared for, it can lead to more complications such as stroke or myocardial infarction. Educational intervention for this project about hypertension. It's a very common disease. It's very costly and also deadly if it's not properly taken care of. It is usually underdiagnosed or usually undertreated in primary care settings. Despite all the presence of effective treatment strategies, uncontrolled hypertension remains a persistent problem in the US today. Implication. The project that I'm going to be embarking on for my clinical scholarly project will be addressing providers, system, and patient barrier which may be effective in overcoming these problems and improving patient compliance. The providers will assist us in this project in increasing adherence to medication regimen, informing the patient about the duration of the study, which will take about 3 to 6 months, making sure the consent forms are signed, reducing patient hospitalization or ER visit during this process. And the providers will also assist in using the JNC 8 guideline as part of their decision-making process in starting, changing, or stopping antihypertensive medications, which are 4 classes: the ACE inhibitors, the diuretics, the beta blockers, and the calcium channel blockers. So whenever they're changing any of these medications, they need to let us know so that we can make some adjustment accordingly. Another stakeholder in this project is licensed medical assistants. These are the group, this is a person who's going to assist us in making sure that patient vital signs are taken and documented. They are also to educate the patient on the diet and exercise, making sure they exercise every day, 30 to 45 minutes, and making sure that they follow up with their providers as scheduled, and clinic managers. The clinic managers are also stakeholders in this project. They make sure that all the necessary supplies for this project is available and all the necessary documents, signed documents, consent forms are filed accordingly. And the last stakeholders in this project is the patient. The patients have to make sure that they come to the clinic as scheduled, on time, they take their medication accordingly, they are compliant with their medications, they are compliant with their appointments, they are compliant also with the lifestyle modifications described to them of caffeine reduction, low salt diet, low fat diet, regular cardiovascular exercise, 30 to 45 minutes every day. Conclusion of my project. The benefit of this study is to reduce hospitalization and ER visit for elderly African American of low socioeconomic status by educating them the importance of medication compliance, and finally, preventing complications from uncontrolled hypertension such as myocardial infarction and stroke. The advantage of this clinical scholarly project will increase compliance to the treatment plan that was established between the patient and their medical providers. It will also increase compliance and reduce hospitalization among these elderly people. Thank you. Once again, my name is Augustine Kehinde from Brandman University DNP program.